is the founder and chief executive officer of Care Organization Public Enlightenment, otherwise known as C.O.P.E, based in Nigeria. Excuse me. Prior to establishing C.O.P.E, Ebun worked in the financial services industry. She's a Nigerian healthcare professional with 25 years experience in advocacy, breast cancer outreach, and community awareness. C.O.P.E has partnered with several Nigerian government parastatals, individuals, and organizations, both at local and international levels, regarding breast cancer programs to support breast cancer patients and survivors. Welcome, Ebunola Anozie.
Thank you, Fumi, for having me here.
Thank you, Ebunola. Thanks for coming on board. Now, you've been involved with C.O.P.E for over 2 decades. What made you establish such an organization, given the African perception of cancer?
In 1970, I lost my mom to colorectal cancer, and in 1995, I lost my father to cancer of the stomach. And I had a scare as well in 1995 when I was in America on vacation. So I went to have it checked, and I was declared free. Right. So I now decided to come back home and do it on a part-time basis. And I found out I couldn't do it on a part-time basis. People were urging me to come and set it up and be there permanently. So I had to do that. So that's my story.
That's your story. Thanks. So how have you been able to break the culture of silence in Nigeria?
It hasn't been easy, because I also remember when I started talking about breast cancer, I noticed that a very good friend of mine had a lumpectomy done, which she didn't even talk about. Right. So I told her that, look, this is what I want to do. Let's let Nigerian women know about this problem, because a lot of people are not coming out. When I came out, I was chastised for coming out to talk about breast cancer, touching my breast, showing people how to do it. It was a difficult period for me at that time. But luckily, people have embraced it. And with what we're offering here, we have a lot of people who come and have their breast examined. So it hasn't been, it's been a fulfilling journey, but not that easy, trying to get women to still come and have their breast checked.
So what type of support do you offer the survivors or breast cancer patients?
It's always very traumatic after you have been through that ordeal. Mm-hmm. Because Flo, I must commend you. I must commend Flo for that. It's not an easy journey. What we do at first is allow them speak their mind, say their story, mm-hmm. Bring out the best in them, make sure that they're willing to talk about what they went through, because you can't really push it out. No. You have to let them flow with other people. Mm-hmm. What we have in our group, they call themselves One Nation, bearing in mind that they all have one breast. And we let them have the prosthesis. We have the prosthesis, which is right behind me here, the bras. Mm-hmm. We give them that. We let them regain their self-esteem, right, and be able to talk about how they feel. Mm-hmm. Mm-hmm. A lot of them had stories to tell. Right. Coming to the support group, how they were treated in the hospitals. The doctors not following the rule of spikes, mm-hmm. and we have to do that from the beginning to reassure them that everything is going to be fine. And then we also encourage the family members to be part of the group, and we encourage them when they go for their clinic and to see their doctors, to invite other women to come for the support group as well. Mm-hmm. And most importantly, we invite a lot of professionals to talk to them. We have motivational speakers who come. We have the exercising expert. We take them to the spa. We have quite a lot of programs that we offer them, and they're always very comfortable. And we have my vice president, who is a breast cancer survivor. It's about 20 years plus now. And it's encouraging for people to see that you can survive breast cancer if detected early. which is the key thing that we also talk about. And then it's also important that they now teach their own children, the female children, the essence of early detection. So that comes to play as well.
You know, over in the UK here, there's some cancer charities that they go to universities to talk about breast cancer at a very early age, that to check themselves. Do you have something similar like that as part of your educational program?
Yeah, we go to schools, we go to secondary schools, we go to the universities, we go to churches, mosques, we go to organizations, profit-making organizations to talk to them. We go to marketplaces. And then we have the screening machine here. We have the screening done every third Saturday of the month from 10 a.m. to 2 p.m. A lot of women come. And we also, for screening, with the breast ultrasound scan, and we have the doctor and the nurse. The nurse does the clinical breast examination.
Right.
And we have the wall of fame that we use in encouraging organizations to buy into. They support 333 women each every year to come for breast screening. Right. We also have students who come here for their educational, what do we call this thing that they do? It's more like a group thing. They come here to get more information using our Breast Cancer Information Service Center, which is a library.
Okay.
We have a lot that we offer quite a lot of people.
Interesting. How responsive are organizations to funding breast cancer programs, given the African mindset and the perception of NGOs?
Organizations are always they're willing to help us. We have quite a lot of organizations supporting C.O.P.E. because of the transparency.
Yes.
And we just acquired another machine recently by an organization, Leadway. We have machines that we can comfortably screen 400 people in a day.
Wow.
With the machines we have. Yes, we have about 4 or 5 machines that we use. So we encourage women to come whenever they have a problem, bearing in mind that on Fridays is a counseling day.
Right.
We open it up for women to come and talk to us if they have private issues. And we also have organizations that sponsor some of these breast cancer support, breast cancer patients, those who are not, who don't have the wherewithal to continue their treatment. So we do that as equally. And then we support caregivers as well. Right. We give them financial support so that they don't worry about having to go looking for funding. That's when the funds are made available to the organization.
Thank you so much for that, Ebu. But what about the breast screening service? Is it free or they have to pay?
It's heavily subsidized. It's just 3,000 naira. That's what they pay. Yes. Because if you were to go out, it's about 15, from 5,000 to 15,000. So here is heavily subsidized.
All right. Thank you so much for that.